All right, moving on. So this guy right here, I like to call a seatbelt. All right. It crosses over the quadriceps, and it's actually the longest muscle in your body. It's called the Sartorius. Sartorius. Yes. All right. So it starts all the way up here on your iliac crest. That's the origin. And then it goes across your quadriceps. And then remember I called it the seatbelt? So click it right there. The insertion is the patella and the tibia. The patella and the tibia. The origin is the iliac crest, the very tippy top of your iliac spine. It helps us cross our leg. Hey, that's pretty cool. It goes across the quadriceps, and the action is to cross your legs. Easy peasy. All right. While we're in this area, I'm going to point out this guy. So this long muscle that is on the inside, this right here, if you can see that, that's the gracilis. All right. It's going to start at the most medial point, most proximal point, which is the pubic bone, and it's going to actually insert on the tibia. It helps you adduct your legs. That's kind of superficial, so I'm going to peel back. Once again, you see your semimembranosus, your semitendinosus, but this little triangle right here, you can see it right here. This little triangle, that's the adductor group, okay? Adductor group. It helps you add to the midline. Once again, adduction. Pubic symphysis, but let's follow it. It's inserted on the femur, okay? If I keep going down under, I will find this muscle right here, the back of the leg, which we call calves, but we have to call these muscles. So this is the gastrocnemius, all right? Gastrocnemius. And what it helps us do, if I want to make my calves contract, I do my plantar flexion. Plantar flexion. So all the action is down here. So it's actually inserted on the calcaneus. The calcaneus is the fancy word for heel bone, and it is going to originate on your femur. Now, to lift my whole body up in plantar flexion is actually going to take a friend. It needs a synergist. The synergist is going to be the soleus. Now, see how this is the gastrocnemius, these like two bellies right here? These, and like, by the way, gastric means like belly muscle. I'm not going to go into that. All right, and so this right here, this little tiny sliver, this little feather friend, that's the soleus. Okay, so they might ask it on a leg model, or they might ask it on this guy, but just look for that little sliver of a friend underneath the gastrocnemius. That's the soleus. Now, it's going to help us lift our body. It's going to help us plantar flexion, so it's inserted on the calcaneus as well, but it's going to originate on the fibula. All right? Okay. The antagonist to the gastrocnemius is going to be this front muscle right here in front of your tibia, and it has a really cool name. It's called Tibialis anterior. Ah, that's easy. Okay, so tibialis anterior, the way it works, it helps us bring our toe to our shin. Okay, it helps us dorsiflex. Remember that you always flex to your origin. So the origin is your tibia, okay? But your insertion is going to be at your first metatarsal. So I think about this action bringing my big toe to my tibia, right? And that helps me know that my insertion is my first metatarsal, my big toe, and then my origin is going to be my tibia. Okay, so I think that takes care of all our down under. And so now let's look at this guy. This is my external oblique, my internal oblique, and my transverse abdominis, okay? I'm not sure how they're going to ask that question or if they ever do. And then we have our rectus abdominis, okay? And then moving up, we have our pectoralis major. Okay, so the way the pectoralis major works, now look at this. Where is the origin? Well, you might ask yourself, what's the most proximal or medial place? Well, you can't get more proximal or more medial than the sternum, so that's your origin. And if you follow the muscle, it will tell you where it's inserted, and that's going to be the humerus. The action is to like basically draw your humerus in. I forgot what that's called. How professional of me.
Protraction.
What is it?
Protraction?
Is it protraction? Yeah. Did you pause it?
Yeah. No pausing.
Did now, right? Let me find that. Pectoralis group. Oh, flexion of the shoulders. Yeah. Okay, start it again. Is it started?
Yeah.
Okay, so that's flexion of the shoulders. I'm sorry. Sometimes Lose my mind. Flexion of the shoulders. And we always know we flex to our origin, so that makes sense, which is the sternum. All right. And it is going to insert on the humerus. Okay, the neighbor here, this guy right here, which, looking at the model, looks like this right here. That is the serratus ventralis. Now, if you see serratus anterior, don't think that your book is wrong. When we talk about animals, we say ventralis. When we talk about human beings, we say anterior. Okay? So I like to call this the triple S because that helps me remember. This is my serratus ventralis. That helps me separate my scapula. All right? So their job is to protract the scapula. Okay? Now, if you look, you can actually see that it's inserted on the scapula. You can see that it's inserted down there. And it originates on the costals. All right? The opposite of the serratus ventralis is the rhomboideus. Now, they would probably ask that on a cat, but I'm not going to make any guarantees. It looks like a rhomboid if you're familiar with that shape. And by the way, if you're on the back, the origin is going to be the vertebrae, 99% of the time. So you can see that it originates on the vertebrae, and then it inserts on the scapula. I like to call this the double R. Rhomboideus retracts the scapula. It retracts the scapula. So the opposite of that was a serratus, which protracts or separates the scapula. Okay? Moving on up. They're not going to ask this on the cat. Most likely they would ask this on a model. But you can see these neck muscles. That's the sternocleidomastoid. Okay, that's a mouthful, but it actually tells you everything you need to know. Sternum, clavicle, mastoid. All right? What this does, it helps you say a prayer and flip your hair. Say a prayer and flip your hair. That's what the sternocleidomastoid helps you do. Remember that you flex to your origin, and these are actually 4 muscles. So the manubrium of the sternum, and the clavicle, those are your origins. And then your insertion is your mastoid. Hence the name is sternocleidomastoid. Okay? Helps you say a prayer and flip your hair. Now the opposite is to look up and rotate. To look up and rotate. And that is going to be the spleenus. This guy right here. Okay? This is going to originate on the vertebrae, as you probably suspect, but it's going to insert on the temporal bone. Okay? So if you look up and you start moving your head left to right, you can see that the action is all right here. Okay? So it's inserted on your temporal bone. Okay, while we're on the back here, let's look at a couple of muscles. This is going to be asked on a model, a trapezius. Okay? It looks like a big kite on your back. It's very superficial. Very big muscle. It has 2 insertions. It helps you shrug your shoulders. So if you start shrugging your shoulders, you can see that your clavicle is going to move up, but you also see that your scapula is going to move up. So the trapezius is inserted on the scapula and the clavicle. It's going to originate on the vertebrae as well as the occipital bone. Okay? Kitty cats don't have deltoids, but models do. Here is my deltoid. All right? It helps me abduct my arm. So you can see that all my action is right here. And then you think, oh yeah, it's inserted on the humerus. If you look up here, you can see how the deltoid comes around like a curtain. It's going to originate on the scapula as well as the clavicle. Okay, it originates on the scapula as well as the clavicle, and it inserts on the humerus. Okay. Also back here, you've got the lumbodorsofascia. Fascia is just a really fancy way of saying a sheet of tendon. Okay. So if you think of Michael Phelps when he's doing the butterfly, you can remember like those wings that expand. That's the latissimi dorsi. It originates on the vertebrae, as you can suspect, but it also originates on the lumbodorsofascia. And it inserts, because if I follow it, I can see that it inserts up here on the humerus. Maybe think about when you're at the gym and you're doing your lats and the lat machine, and you think, oh yeah, it's inserted on my humerus. All right. Also, while we're back here, on the spine, well, on the scapula, you have a spine. Here's the spine of the scapula. And I like to say S-I-N. T, like basically a muscle above the spine of the scapula, below the spine of the scapula, and then on the tip. If the tip is marked, they wanted you to identify the teres major. Above the spine is the supraspinatus. Supraspinatus, above the spine. Below the spine, of course, would be infraspinatus, like inferior, infraspinatus. And then, like I said, the tip, what did I say? Teres major. That's right. Okay? All right. Now, if we were to do any of the facial muscles, we would need a model. They're not going to ask it on a cat. And so if it's circular, you use the word orbicularis. Orbicularis oculi. Orbicularis oral. Right? Right. All right. Let me make sure that I didn't miss anything. I think we got it all. Of course, if you have any questions, please come to the tutorial lab. I know we're closed on the weekends, but I hope this helps you, and come see me at 7 a.m. any morning. Thanks.